let's take Dr. Real quick.
Oh, no,
No. Okay, she's there. Okay, fine. No. What? Hey, it's rapidly evolving. What
protected
can we say?
by Viper.
Right on. Lillian Posadas, hospital administrator. Good morning, Lillian.
Hey, good morning, Chris. Good morning, Bree and Jace and everyone, and good morning, Guam.
Amen. Let's just jump right into it. So obviously, we love to get you on here every couple days to do our GMH COVID census. So what are the latest numbers?
It's at 33 this morning, and of the 33, 7 of them are in the at the ICU level of service care, and of the 7, 5 of them are on ventilator support. We do have 6 individuals over at the SIF facility, transitioning to either home or to the ISOFAX. So that's where we are with our census, which we hope will continue to go in a downward trend. Right. Although next week we're anticipating that perhaps, 14 days after the Thanksgiving celebration, there may be, but hopefully not. Hopefully not, because I think a lot of people really are taking heed of the recommendations to continue the social distancing and not have all the celebrations. They sacrificed that this year, so hopefully that will come out to be a very good result.
Lillian, we haven't seen a death reported this week. Has there been any deaths overnight?
Correct.
That have
Knock
not?
on wood, we haven't seen any this week, so hopefully none.
And what's the morale like there at the hospital? Is it it seems like you guys have just a bit of breathing room compared to the high number of hospitals.
There is some time, but our non-COVID census is picking up, and so we're seeing individuals who haven't been able, I suppose, to see their doctors, or haven't been able to make it to their appointments or get their medications refilled. So we're seeing an increase in the non-COVID, which is fine. This is what we're here for, also to take care of them. So yes, but the morale, for the most part, the staff are feeling pretty good, feeling pretty excited that the numbers are going down.
Mm-hmm. Any updates on Bamlani Mifop and the convalescent plasma?
Bamlan.
Okay.
Yes, right. We have the 7th individual received the transfusion. There's possibly 2 more today that have consented and are wanting to receive that treatment, that antibody therapeutics. So, we continue to encourage the doctors to prescribe that, to order it.
Mm-hmm. And convalescent plasma?
Convalescent plasma, that 6 units were administered, and I thought that there were 6 individuals that received it, but correction, 2 individuals received 2 units. Okay. So but still a total of 6 units were transfused.
And any complications?
Any what?
Complications with any of the patients?
No, we haven't. Knock on wood again, we haven't heard any adverse effects or complications or reactions to either one of those therapeutics.
Mm-hmm. The tents, is that tent still up?
The Blue Med tent?
Yeah.
Yes, it is. And we use it to fast track, COVID patients. We also use it if the ER is really full, then we use that tent to administer the antibody therapeutics, the outpatient therapeutics.
Mm-hmm. Are you guys still looking at the SIF, using it for COVID, non-COVID, fixing the HVAC over there?
That's still the plan. Yes, absolutely. But the doctors are still, sending patients, transferring patients to that facility. Mm-hmm. So that is still the plan, is if we can clear that facility, and then the contractor can work on the HVAC system to separate it. Absolutely.
Okay. Do you have any information, any updates on vaccine?
Not recently, other than what Janella mentioned yesterday, that the Pfizer vaccine, that's been their discussion with CDC. As soon as it gets the EUA approval, then the distribution is going to come to Guam. I understand now the number of doses is somewhere like 7,500 doses will be coming to Guam, and it will be shipped frozen. And so we're going to be meeting with public health to get more details in terms of how then the distribution will be throughout the island. Primarily, it will be the 2 hospitals, GMH, JRMC, and then the public health clinics. And so that's my understanding from the discussions I've had with the public health authorities and officials. And so, we've got a tentative plan within the hospital that we will have several pods to them for the nursing team to administer the vaccines to the individuals or the employees who are willing to take the vaccine.
And again, is it still 70%? Is that what you said?
Right, 72% so far of the employees have responded affirmatively that they would like to take the vaccine.
And what about the freezers? Public Health did say that they had, I think they had a couple. Will they be going to GMH?
I'm not sure because, like I said, they will be the ones to receive the allotment, the of the frozen vaccines, and then by the time that they will then distribute it to GMH and the other health facilities, it may be already thawed out. So we may not need to have the freezer, but we need to keep it in a storage container that will still maintain the temperature before we administer it. And I'm not sure that, we're waiting again for information on it. When do we administer it? Or what temperature do we administer it? Because I'm not sure that we could even administer it when it's frozen. So those are all the details that we're waiting to receive and, from CDC and from public health.
Okay. Anything else from GMH?
No, but hopefully let's all continue to wear the mask and keep the distance and minimize the social gathering as much as possible still.
Thank you, Lillian.
Thanks, Lillian.
Thank you too.
Be
You
safe.
take care.
Have a good
Happy
weekend.
Friday.
Okay. Let's keep it in the Zoom room and go over to Dr. Michael Lum of the Physicians Advisory